Welcome to the Bioethics Babe podcast, where we examine the tough questions in human flourishing in light of science, faith, and culture. I'm your host, Arena Grosso-Agnew. Now let's dive in. Infertility affects millions of couples and can be one of the most painful crosses a husband and wife will ever carry. When the longing for a child collides with the reality of infertility, many couples find themselves facing difficult questions. What fertility treatments are morally acceptable? Is IVF ever permissible? What about IUI, fertility drugs, embryo freezing, genetic testing, embryo adoption, or newer reproductive technologies? Modern medicine offers more options than ever before. But just because we can do something technologically, does that mean that we should? If certain fertility treatments are unethical, what options remain for couples who desperately want to build their families while remaining ethically grounded? Today we're joined by Joe Zalot, Director of Education at the National Catholic Bioethics Center. Joe has responded to more than 2,400 ethics consultations and spent years helping individuals, families, healthcare professionals, and clergy navigate some of the most challenging questions in modern medicine. In this episode, we discuss the emotional reality of infertility, what makes certain fertility treatments morally acceptable or unacceptable, the ethical concerns surrounding IVF, and why the Catholic Church distinguishes between technologies that assist human fertility and those that replace the marital act. We'll also tackle some of the most difficult questions regarding assisted reproductive technologies and what hope exists for couples who want children but are striving to remain faithful to Catholic teaching. Joe, welcome to Bioethics Babe.
Arena, it's great to be on your podcast. And before going on, I'd like to congratulate you on the Bioethics Babe podcast. I used to host our NCBC Bioethics on Air podcast, so I know how much work it takes to put these things on. There's a lot of work behind the scenes that people don't know about, so I really appreciate that. And also wanted to let you know, if you give me a second, that I used to host, as I mentioned, the NCBC's Bioethics on Air podcast. And when I became the director of education in 2023, I just don't have time to do it. Since then, I just don't have time to do it anymore. And I was looking for a good, faithful Catholic podcast to use in our education programs, to bring in, to get the perspectives, faithful Catholic perspectives on ethical issues. And ran across Bioethics on Air a number of months ago. And I'm really appreciative of what you're doing, because you're interviewing many of the people who I wanted to interview, and you're exploring the topics that I want to explore. So I'm using the podcast in our NCBC education programs, in our certification program, and also in our high school course. And you've also been very good in terms of, I remember I emailed you a few weeks ago before recording this and I said, I need a podcast on sort of a state of the union on science. And you said, hey, I'm interviewing David Prentice. And I said, can you do it quicker? And you did. And so we're using David Prentice's, we're using Marguerite Duane's on FABM, Tara Sander Lee's on IVF, and a lot of the other ones as supplemental material. So before starting, I just wanted to congratulate you and thank you for your work on Bioethics Babe.
Thank you so much. And it's really actually an honor that NCBC program is using it. It's kind of coming full circle. I studied with you all. I studied at the University of Mary, and it's great to be able to give back to the students now and give them an opportunity to listen in and just kind of join this conversation, because our conversations, we want people to feel like they're part of the conversation in these big questions. And so I'm really glad to hear that. And thank you for all the work you're doing in training the next generation of students who will take up this fight for human dignity. So thank you for that.
Yeah, we're all in it together. So this is good.
So let's first start with a background on how you have become interested in bioethics, and the fact that, so you worked at in hospital ethics and spiritual care before joining the NCBC. So how did seeing real patients and families shape the way you approach infertility ethics today, since infertility is our topic?
That's our topic, yeah. It's really interesting. I worked in a hospital, in a Catholic hospital in Cincinnati for about 2 years, but to be honest with you, we hardly had any ethics consultations. It's really interesting. In fact, I had more consultations my first day doing consults with the NCBC than I did in the entire time I was at the hospital. But I think a lot of the issues and kind of my formation on these issues came about because of my teaching. So I was a college professor for about 12 years, and a high school teacher before that. And it's, in those contexts, particularly, dealing with college age students and high school students, where these issues come up, and the people are very, obviously very interested in it. And my own research and having and presenting church teaching and really getting into some good discussions, really that's really what that piqued my interest on these issues and really all issues concerning bioethics.
Hmm. And speaking of consults, you've responded to more than 2,400 ethics consultations through the National Catholic Bioethics Center. How often do questions about infertility and fertility treatments come up?
They come up occasionally, but honestly, not as much as you would think. Most of our consultations deal with end of life issues. Not to say that fertility issues and things don't come up, but it's not that common. But what's really interesting, so if the phone rings and I'll see on the caller ID that it's, Saint somebody's parish, I know that it's a priest who's calling in. And the priest is usually, when priests call into our consult line, they're usually calling about infertility or pregnancy complications.
Hmm.
So really, a lot of the consults that I get concerning infertility are from priests who are working with their parishioners. So that it's kind of an interesting dynamic, how that works.
That's actually really good to know because in one episode, actually, we were talking about miscarriage and infertility with Gabriela Anastasopoulou. And we were talking about how there's a greater need for education about infertility and miscarriage, especially for parish priests to know how to
Absolutely.
speak on these issues to their parishioners. And even in the homilies, right? So many people in the pews are struggling with this. And it would be great to have that. And in addition, this should be part of marriage prep, Catholic marriage prep. You want to know about NAPRA technologies, but you also want to know what to do in the case of fertility issues or miscarriage, because it's more common than people realize, right? With miscarriage, it's 1 in 4 pregnancies ends in miscarriage, and with infertility, Catholics, especially since we're talking about Catholic ethics, although this
Mhm.
can be applied broadly to anyone
Sure.
who wants an ethical route, they should really know what's out there for them. And this is why we're doing this episode, because it's not just about what is not moral to do. There are moral options to
Absolutely.
pursue. And
Yeah.
that's what we want to say. There's good news in this, that there are technologies that can be applied.
Yeah.
Mm.
Absolutely. And if I could just jump in on that, it's just a couple things about parish priests. One of the things when a priest does call up about infertility issues, the line I get, I wish I had $1 for every time I heard this. They will say, "Joe, I know we talked about this in the seminary, but that was 30 years ago, and I don't remember. Can you help me with this? Like, what's going on?" And many of them and many people don't know, as you said, that there are ethical assisted reproductive technology interventions that can be done. But what's also, and this has happened, this is a scary one too. I was having a conversation one time with a woman who she and her husband were experiencing infertility, and the priest advised them to do IVF.
Mm.
So that's just, that's a priest who is just not is just misinformed really about what the church teaches. So it's really, really important to educate people. And that's what my job at the NCBC is to do as director of education, is to provide education, not only what the church teaches, but why it teaches it and how we practically apply it in our lives. And hopefully our interview today will be a really good example of that.
Yes, absolutely. And before we dive into this topic specifically, was there a particular ethics case, experience, or moral question that convinced you that bioethics was urgently needed in modern medicine?
I think there's a number of times that's happened. One of them being, as I just mentioned, the priest who advised this couple to do IVF. But if you indulge me for a second, I'll tell you a story, and I tell this in lectures that we do in our 2-day seminars and when we present. A number of years ago, I was I was teaching at a small college in Cincinnati, and I was the ethics guy, right? So I taught all of including the healthcare ethics course. And we had an RN to BSN program, so registered nurse to Bachelor of Science in Nursing. So nurses who hadn't completed their bachelor's degree, it was a bachelor's completion degree. And so we would go to the hospitals, and I taught the healthcare ethics course in the hospitals. And best experience teaching I ever had in my life is 3-hour classes on Wednesday nights with nurses who had been had been practicing medicine for anywhere between 5 and 40 years. It was the healthcare ethics class was awesome. But anyway, one day I was doing the principle of double effect, and we won't go through the whole principle, but the example I used was increasing pain medication at end of life. So the question, a patient is in great pain. The dosage that they're getting now is not alleviating their pain, but there's a fear, and I know there's discussion about this, but there's the fear that if you increase pain medication, you could, suppress the patient's respiration and possibly death may happen sooner. But we went through the principle of double effect and used that example and showed that, it can be permissible to increase pain medications because your intent is to alleviate pain. At the end of class, one of the nurses, I'll never forget her, she came up to me in tears. And my first thought was, oh no, what did I do? Because anybody who teaches knows that, you say something, somebody misinterprets it and then it's not a good scene. So that was my first reaction. But she came up to me and she's crying and she said, Joe, thank you. And I said, what? Like what? What's going on? And she said, for that discussion about double effect and pain medication, because that was me. My mother, a couple of years ago, my mother was dying of cancer. I was taking care of her. And I was doing that. I was increasing her pain medication because, it wasn't alleviating her pain. And I thought that I killed her. And I realize now, because of this class, that I didn't kill her. And I was just stunned. And, because you do these lectures, I've done the lecture 100 times or 1,000,000 times, whatever. But it's the distinction between, an academic discussion of something and then in real life. And that really demonstrated to me that, what we're talking about, what you talk about on the podcast and what we do in our education programs, they really impact people in a very real way. The same nurse came back the next week and she had a huge smile on her face. And she said, Joe, I got to let you know, over the past week, I slept through the night for the first time in 2 years. And it's just like, wow. So just, a little education, a little education goes a long way. And I think that really demonstrates to me the importance of the work that we do at the NCBC and Arena, the important work you're doing on Bioethics Babe.
Yeah, I mean, what a beautiful story. And this is a point that I make too when I speak, that bioethics is not just an academic discipline. Obviously, it is, but it's that it touches us personally. Because
Absolutely.
whether you have someone at the end of life in your family and you're trying to figure out what's the best route for them, maybe you're the advocate for that person, or whether you're struggling with infertility or miscarriage, or have someone in your family or your friends who's gotten an abortion or is considering it. These issues are touching every bit of our society and even our families and our friend groups. And it's so important to be educated on these so that we can be a source of knowledge for others in cases in our own lives, in our own families. But yeah, I mean, thank you for the work that you're doing. And yes, these principles need to be more publicized because a lot of modern secular bioethics just doesn't cut it. It doesn't explain it as clearly. And I think that the reason why, as you know, the reason why I started the podcast is because I think that there needs to be this education and to re-educate culture about why human dignity matters, why these principles matter, and how they can be applied to our daily life.
Absolutely. Yeah.
So let's dive into the topic for today. So infertility. Before we get into the technologies and procedures, can you speak to how does the Catholic Church view the suffering of infertility itself?
Yeah, that's a big question. That's a huge question. And I think we have to start start with God's command in Genesis where, he tells the first two people to be fruitful and multiply. And, it's a calling for humans that, we're called to be parents. There's a natural desire to be parents. And, many people are called to do this. They want to have children. And so when infertility occurs, this is a huge. It's a huge, profound cross for people, spiritually, emotionally, even relationally. And so we have to see it as, and look at it as a cross, as a source of suffering for people. Just another shameless plug for the NCBC. A few years ago, when we were doing Bioethics on Air, I did a podcast with Dr. Marie Meany. She's the wife of Joseph Meany, who is our former president. She's now one of our senior fellows. And in that podcast, Marie discussed how her faith sustained her in her struggle with infertility and inspired her to write a book. It's called When Expecting Doesn't Happen, Turning Infertility into a Journey of Hope. And she did it's a wonderful podcast, and it's a great book as well, too. And she does a much better job, certainly, than I can do, about talking about this cross and talking about how infertility really impacts people, and how her faith helped her to deal with it, really, in faithful ways.
Beautiful. And we'll link to her book as well. We had Lee Snead on talk about her book, Infertile but Fruitful.
Right.
And again, it's a cross, and just navigating that, especially when you're not expecting it, right? You're
Mhm.
expecting that you'll get married and everything works as it should, and then you realize no, there's some problems, and it's hard. There's a lot of aspects. There's a lot of dimensions. It's the emotional. It's the psychological, the physical,
Sure.
all that's involved.
Yeah. And interesting, Marie's situation, she was talking about secondary infertility. So
Mhm.
she and Joseph actually had a child. And then when they tried to have a subsequent child, that's when they started experiencing the infertility. And I know another couple, it's the same way. So it's something that you don't, and she talked about this as well. It's not what you normally think about in terms of infertility. And one of the things people would say to her would be like, well, you already have a child, so that should make it okay. And it's like, that doesn't help, you know? Uh, so she's bringing another perspective in on this as well.
Mhm. Right, and it's super important because that can happen exactly as you say, even after you have a child where you have subsequent health issues or whatever it might be causing. Sometimes it's just unknown what's causing the
Right.
infertility. Have you encountered couples who felt abandoned by the church because they were told certain fertility treatments were immoral?
I have not personally in our consultations or anywhere else. However, I am aware that there are people who do experience anger. My guess is, and that probably a lot of that stems from the fact that these people probably don't know church teaching or why the church teaches what it does. What I have experienced are people who experienced infertility, they did IVF or other illicit intervention, and then at some point in the future, either they had a reversion to their faith or they just came to learn what the church teaches and why, and they've actually repented of their prior actions. I mean, what I would say to people who do feel abandoned, as you said, is, and we mentioned this earlier, and I know we'll talk about more a little bit later on, that there are options for them. I think there's this understanding that, if a couple is experiencing infertility, the Catholic Church says there's really nothing you can do except pray. And that's actually not the case. So, again, I think it's an example of, education can go a long way in terms of what is permissible and not permissible.
Mhm. And probably some of that anger too is if a couple doesn't quite understand the moral implications of a treatment such as a procedure like IVF, they might just say, "Well, I want a child." And one of the things we've talked about in other episodes is that children are gifts; they're not owed to couples, and so just wanting, obviously, the desire for a child is a very good thing, but the ends don't justify the means. And so with that, it's let's find the moral means to try to do the best we can for that conception to happen in a way that is ethical and moral, and not just say, well, because I want a child, I will do whatever it takes, even if it's immoral means, right?
Sure.
So in your experience, what are the biggest pressures that infertile couples face from doctors, family members, or even fellow Catholics?
Well, I think from a physician's perspective, I think one of the things that the pressures that people hear are, hey, we have this technology available to you. Why aren't you willing to use it? It's kind of there's a bewilderment that, we can give you what you want. Why do you not want to pursue it? I think maybe from family's perspective, and this may be an implicit pressure, but, the parents want, I mean, parents want their children to have parents want husbands and wives want grandchildren. I mean, and so there's, when their son or daughter gets married, there's kind of an implicit pressure there to, hey, have a child. How come you're not having children? We want grandchildren. And I think that that pressure can be there, or, people can feel that. And, from the church, again, I think it's probably more implicit than explicit, but, couples go to church and, they see other families, they see young families, and, they know that the church, in fact, one of the reasons why couples marry in the Catholic Church is to become parents, to have children. That's a necessary part of, you have to assent to that in order to be married in the Catholic Church. And so, there's these, I think, there can be explicit pressures, but I think there's implicit pressures that people are facing.
Right. And I mean, obviously, the church looks at the marital union as unitive and procreative. And when you make your vows, you have to be open to
Yep.
children,
Yep.
but it doesn't mean the church doesn't quote unquote make you have children. It's that you have an openness. And obviously, couples
Exactly.
who are struggling with infertility are having trouble with that. But there is that openness that when a couple comes to the altar and makes their vows, they're saying, we are open
We're open to it.
to having children, and our marital union will be open to that,
Yeah.
both unitive and procreative.
And I think most people aren't expecting infertility.
Right.
When you're standing on the altar exchanging vows, you're not expecting infertility. And it's something that you weren't prepared for.
Right. And actually, this was something that we also spoke in another episode, that it'd be so important for marriage prep classes to teach all the things, teach natural procreative technologies, but also talk about infertility, talk about these ethical treatments and procedures that can be done, as well as talk about miscarriage, because I think these other issues aren't really talked about. Maybe NAPRO technologies are talked about, or even um, fertility awareness is talked about
Mhm.
in some programs, but not this. And since so many couples may be facing it and not expecting it, and no one's talking about it, where do they turn? And I think that
Right.
this is what we're trying to help educate. And as you were mentioning, if there is that implicit pressure or even explicit pressure from family members, being able to understand why some procedures are ethical while others are not is an opportunity to educate even your own family. Say, well,
Absolutely.
no, we're not going to go this route because of X,
Absolutely.
Y, and Z, but we are going to pursue X, Y, and Z. And I think it's just an opportunity to share more of what the church teaches, and the good news of what is out there that can be applied.
Sure.
What would you say to a couple who feels torn between their longing for a child and their desire to remain faithful to Catholic teaching?
What I would say, I guess, first of all, and I'm thinking about this in the context of a consult that we would have. I'd say the first thing I would do is encourage them to really get to understand what the church teaches and why. Because again, we've talked about, and we'll talk about more here. There's a lot of misconceptions. Sorry for the pun, about what the church teaches concerning infertility, but understanding the why. So the connection between procreation and union, which we can go into a little bit more later, as you mentioned earlier. But understanding exactly what options are available to you, what options are, or what options are permissible, what options are impermissible, and the rationales for why. And I think to start there, because I really think a lot of the confusion, a lot of the anger, as you said, as mentioned before, is really rooted in ignorance. And I don't mean ignorance necessarily in a negative way, but ignorance in the sense that, and I've said this on numerous occasions, that as an institution, I think our church has done a very poor job of educating people, maybe not so much on the what, but on the why. And I think that infertility is actually a really good example of that. So let's start with the whys, with the whats, and then the whys. And let's say, okay, now let's apply this to your particular situation. So I think that's how I would start with a couple who's
Mhm.
experiencing infertility.
Yes, and let's now speak particularly about IVF, because that is, I guess, the number one way that the fertility industry is pushing for as a quote unquote solution to infertility. Where I call it as a way to bypass your infertility, not as a solution to getting to the root cause
Sure.
of the infertility, but to bypass it.
It's exactly
So
what you're doing.
many Catholics feel confused, overwhelmed, or even hurt when they encounter the church's teaching on assisted reproductive technologies, and especially IVF. Why is this issue so emotionally charged?
Well, it's almost emotionally charged, I think, for some of the reasons we talked about already. But in addition to that, procreation is very personal, right? There is, we mentioned before, there is a natural drive within humanity to procreate. I mean, actually, probably within any animal to procreate. We need to procreate in order to perpetuate the species, right? So we have to do that. But there's also a desire within us to be parents. So it's a very strong, very personal drive that's within most of us humans anyway. Also, I think it becomes emotionally charged because procreation goes hand in hand with sexuality, and we live in a culture that essentially says I can do with my body whatever I want to do, and that can be extended to any number of different different areas. And when we start asking questions about that and saying actually, well, maybe not, maybe it's not morally permissible to do whatever with your body you can't do with whatever you want to do with your body, people are going to react to that. And then also, I think that there's a societal belief, and you mentioned this already, but there's a societal belief that adults have the right to have a child, right? And this applies certainly to married couples, but also to single people who are in same-sex relations. You have a right to a child. That's what society tells you. And in fact, that's what I think the whole assisted reproductive technology industry is based on. It's this belief that you have a right to a child. And when someone tells a person, well, actually, no, you don't have a right to a child, or you're not in a situation that is in the best interests of a child, they bristle against that. And that's, this is the result of our society. And then there's also just the profound moral questions that come up with IVF, which we'll get into in terms of, what happens to the embryos and things like that. So there's a lot of different issues, and the IVF question can be an ethical landmine, and it's one that has to be navigated very carefully sometimes.
Hmm. So let's talk about what, at the core of Catholic teaching, what distinguishes a morally acceptable fertility treatment from an unacceptable one?
Well, I think there's two things. So the first is the distinction between what we call heterologous interventions and homologous interventions. So if we're talking about an intervention for infertility, we always have to be talking about the husband and the wife, right? And we can't bring in a third person, right? So we're always talking about husband's sperm, wife's egg, wife gestates the child, right? So that's number one. Number two is the distinction between assisting and substituting for. So the Catholic Church will teach that, or does teach, I should say, that an intervention for infertility that assists the conjugal act, that assists an active intercourse in achieving pregnancy, can be permissible. Generally speaking, is permissible. But if that intervention substitutes for or takes the place of the marital act between a husband and wife, that's not morally permissible. I mean, it breaks a procreative unitive connection and among other things as well. So if you're bringing in, an egg, people oftentimes use the term egg donor. I always use the term egg vendor because people generally aren't donating their eggs; they're selling them. Eggs, an egg vendor, a sperm vendor, or a surrogate. Right? If you're bringing a third person in, or that goes to the heterologous homologous. And then there's the procedure itself. Is it assisting an active intercourse, or is it substituting for it? So those two things together have to be taken into consideration.
And so, given that, why does the church insist that procreation remain connected to the marital act rather than being produced technologically? Why is it so important that a child is conceived in the marital union between a husband and a wife?
There's a lot to that to that question. A couple of different things. One, I think, starts with talking about the dignity and rights of children. So there's a wonderful document called Dunam Vitae, the Gift of Life, that was put out by the Congregation for the Doctrine of the Faith of the Church back in 1987. And I always point out that this is 1987. So as we're recording this podcast in June of 2026. So this is almost 40 years ago. And so for those people who say, oh, the Catholic Church just reacts to all of these. No, this is the church being really proactive. This is right after, within a decade of IVF becoming a reality. The church is talking about the ethical issues involved with IVF. And one of the things that they focus on, which we in our society don't focus on, is the dignity and rights of children. right? The ART industry is focused on the rights of adults, right? Or the so-called rights of adults to have a child. So what does Dunham Vitae say about the dignity and rights of children? Well, first of all, they start off, all human beings possess inherent dignity because we're created in the image of God, right? So we always have to keep that in mind. But then they go into, and Irina, you mentioned this earlier, that children are a gift. And we have forgotten that in our society today, right? Children are a gift from God. And Dunham Vitae says the quote, the most gratuitous gift of, children are the most gratuitous gift of marriage, unquote. All right. They always have to be seen as a gift. And so because of this, a child is a subject or an end in and of herself or himself. It's not an object of ownership. It's not a piece of property, or it's, an object. It's not an object to which another person has a right, right? And so what we always have to keep in mind is that a child is not owed to anybody. Nobody has a right to a child, nor do adults have a right to a child, no matter what our culture claims. And so these and for other reasons, the church also holds that children have a right to be conceived and gestated and raised in a manner that's consistent with their dignity, right? And there's real questions in terms of IVF and other reproductive technologies, but really focusing on the dignity of rights of the children. Then it also speaks, and I'll be a little quicker with this one, that procreation always has to occur within marriage, right? In Dunham Vitae itself, every child has the right, and I love this, to compare this with our societal understanding of the rights of adults to have children. The child has a right to be conceived by, gestated by, born of, and raised by its biological parents in marriage. This is the right of every child. And part of this, and it's not the only reason for this, but part of the reason for this is that, social science has demonstrated to us, and societies have known this forever and a day, that children are, the best context for children to be raised and to become productive members of that society is within a marriage between their mother and father, right? And that's been demonstrated again and again and again. So again, for these and for other reasons, really have to focus on the child in terms of these reproductive technologies, and not simply on the desires or the so-called rights of adults.
I think that's really well said. But some people will say, okay, but if the goal is a baby, why does the method matter? How would you answer that?
Well, it goes back. There's a lot of things that we can bring about by immoral means. And so, for example, let's say, and this may not be the best answer, but for example, we may want to bring about world peace. Well, one of the ways we could bring around world peace is if we nuke all the countries that are opposed to us. Is that a good thing? Is that a good action? And the answer obviously is no. The question is, I think, in terms of reproductive technology, sort of using that analogy, and all analogies are not perfect, but what are you doing with, for example, IVF? What does the action do? Right? It separates procreation and union, as you've talked about on previous episodes, and we could talk about that more as well here. What does it say about the dignity and rights of the child? And then there's also the very practical issues of, well, what do we do about, can we freeze children? What do we do about multiple pregnancies? What do we do about quote unquote leftover embryos? These raise very practical and profound concerns that actually people call us at the NCBC with, because they find themselves in these situations. They've never thought about these realities before. And they find themselves in situations where they're faced with very profound ethical challenges, things that they never thought of when they started the process of IVF. And now they have to deal with them. So
Right.
again, there's a number of things going on here.
And at least according to the estimates I've seen, there's at least 1.2 to 1.5 million frozen embryos in the US alone. You might have other stats about that, but we'll do a whole show on frozen embryos, both from various Catholic bioethics angles of what is a solution to that. But these are the types of issues that come up when we don't follow the church's really wise teaching on reproductive technologies, because then there's more lives implicated. These embryos that are left in a gray area of, they're frozen. Are they frozen indefinitely? Do you thaw them. There's so many issues, and we'll talk about some of that as well. But
Yeah.
obviously, as we've been saying, the church is not opposed to reproductive technology itself. There are morally acceptable technologies, and there are morally impermissible technologies, and then there's a neutral area where there's a gray zone where the church hasn't spoken clearly about whether or not those are acceptable. So I think we should just go through some of those more specifically for
Sure.
the benefit of our listeners here. So, what fertility treatments are generally considered morally acceptable within Catholic teaching? And I can go through each one, and maybe you can speak to why that one in particular is, acceptable. So, for example, hormonal treatment for menstrual irregularities. If you can speak to why that's acceptable.
Well, that's acceptable because what the hormonal treatment is doing is seeking to correct something that's off in the body. And so what that particular intervention is doing, it's assisting an active intercourse in achieving pregnancy. Remember the two things to keep in mind is it must be homologous versus heterologous, so just the couple themselves, but also the assist versus substitute for. So if you're addressing a pathological condition in either the woman or the man, here hormonal treatment for menstrual irregularities, what you're doing is you would be assisting an active intercourse in achieving pregnancy. So that would be certainly permissible.
Mhm. What about imaging and diagnostic techniques?
Same thing. I'm assuming the purpose or the intent of the imaging and diagnostic techniques, what you're doing is you're trying to figure out, okay, what's going on here? Is there a pathology there that's causing the infertility? Let's get information about that pathology and let's treat it and therefore assist an active intercourse in achieving pregnancy.
Mhm. Uh, Surgery for blocked tubes or endometriosis.
Same thing. There's a physical pathology that is preventing conception from happening. Let's address that with blocked tubes, or if there's a blockage in the fallopian tubes, or a woman is experiencing endometriosis, we can do surgery for endometriosis. Again, it's assisting an act in achieving pregnancy.
Fertility drugs for anovulation. This is when a woman is not ovulating.
Yep. So if a fertility drug to help her to ovulate so that there's an egg available to be fertilized, again, it's certainly permissible. I would just a caution there because I don't want people to get the impression that like with IVF or what happens here with IVF is a little bit different because they're given ovulatory drugs to over ovulate to to produce quote unquote multiple eggs, and that raises health concerns and whatnot else. But if it's the idea is to help a woman to ovulate an egg so that it is available to be fertilized, not a moral problem.
Right. And with IVF, because the body is basically forced to over ovulate,
Right.
there could be ovarian
Yep.
hyperstimulation syndrome, et cetera. A lot of issues that can come because you're trying to force the body to do something that it wouldn't do on its own naturally. You're not going to ovulate multiple eggs unless
Right.
these drugs are trying to force your body to do that.
Yeah. And Tara Sandra Lee did a great job talking about that in your interview with her
Yes.
about all of the effects of hyperovulation syndrome.
And what about treatments like Viagra for erectile dysfunction?
Again, the same thing. Viagra is seeking to help a man overcome a physical pathology, whatever that case may be, and to be able to gain and sustain an erection so that he can to deposit the semen in his wife's vagina so that fertilization can occur.
Mhm. What about techniques to improve sperm production? And if you can name some of these.
I'm not a medical doctor, but I know that there are hormones and things that can be given, and that certainly would be permissible to do. Again, the medications are given to help the man to produce sperm or more sperm or stronger sperm or healthier sperm for the purpose of achieving pregnancy. And if that's what's being done, it's not a problem.
And I've read too that there are supplements that can help both sperm quality and egg quality.
Mhm.
So those two are available to people because if it's reducing oxidative stress or just giving your body more of the vitamins and minerals that your body needs to create better quality sperm or
Right.
improve the
Yeah.
egg quality, those are all permissible.
Yeah, absolutely.
What about surgical correction of reproductive abnormalities or physical barriers to conception? And what are some of those abnormalities that can happen that can be corrected surgically?
Well, again, I think we mentioned some of them already. If there's a blockage in the fallopian tube, or there might be some scarring material, say from a previous ectopic pregnancy. Endometriosis, that's a big one. And in fact, with naprotechnology and restorative reproductive medicine, that's one of the big things that they deal with is endometriosis. So, yeah, so surgical procedures that can correct those abnormalities certainly are morally permissible.
So even conditions like bicornuate uterus, where the uterus is divided, where there's physical barriers that prevent conception or prevent a, a baby from implanting and
Yeah,
growing, those surgeries can also be done.
absolutely.
And what's low tubal ovum transfer?
Well, as far as I understand it, that is a if there is a blockage or something in the woman's fallopian tube, you could take an egg and move it to a point in the fallopian tube where the sperm would be able to access it and to achieve pregnancy. And again, that would be something that would be that would be permissible. Again, because what you're doing is you're assisting in active intercourse between a husband and wife in achieving pregnancy, not substituting for it.
And all of these probably fall under the natural procreative technologies or what we would call restorative reproductive medicine. Are there other ones that you could think of off the top of your head that would be morally acceptable?
Not off the top of my head, but what I would say, and Arena, you mentioned this earlier, that the the great thing about naprotechnology and about restorative reproductive medicine is that they actually address the causes of infertility. So I'm hoping that, people who are listening to this podcast who may be experiencing infertility and saying, "Oh my goodness, what can I do? What can I do? What can I do?" Well, we just went through a list of about 10 things, that can be done. And what the point of the technologies, naprotechnology, restorative reproductive technologies, which again incorporate a lot of these things, is that they actually address the root cause of infertility. And as you mentioned, IVF doesn't do this, right? And, infertility is often a symptom of something of a pathology or something that's off in the body of either the man or the woman. And NAPRO and restorative reproductive medicine, again, it seeks to address this, seeks to identify it, address it so that pregnancy can result naturally. IVF essentially doesn't care. They don't care about the health of the husband and the wife. They just say, listen, we're just going to bypass all of this. Give me an egg, give me a sperm. We'll put them together and we'll implant them back into the mother. So it's, in addition to being ethically, to being ethically, to be being moral, or, ethically acceptable interventions, naprotechnology, our restorative reproductive medicine, the things that we talked about actually address the causes of infertility, which IVF doesn't.
And I recently heard a good point made that because IVF doesn't actually address the underlying causes of infertility, if, for example, you're conceiving but basically the baby dies at implantation, even if you conceive via IVF, the same issues are going to happen when
Exactly.
those babies are implanted because you're not addressing the underlying causes. Well, maybe you have low progesterone, or
Exactly.
maybe, like we were talking about, there's scarring of your uterine lining that's not allowing implantation. And so, again, getting to the root cause of the fertility issue will resolve that. And even if you, even with IVF, where babies are created in a petri dish, it won't resolve some of these other issues where miscarriages can happen. And obviously, we know with IVF, there's a lot of embryo
Yep. Yep.
involved, uh, even after
Absolutely.
they're implanted. So
And one
again, a
and
great
one
point.
other thing on that, if I could just jump in, I've talked to doctors who work in restorative reproductive medicine, and what they say is that if you look at restorative reproductive medicine versus IVF, restorative reproductive medicine is twice as effective in terms of achieving pregnancy and costs on average one quarter the amount.
Mm.
And so just from some very practical, from a very practical perspective, naprotechnology, restorative reproductive medicine is, it's much more successful and it's a whole heck of a lot cheaper.
Yeah, and that's the secret that the fertility industry doesn't want out because
Oh,
they
they
make
are
a lot of
working.
money off of
Yes.
IVF
Oh,
and
yes, the fertility industry, and I like the way how you say it, fertility industry, because that's what it is. They're there to make money. The fertility industry is putting up as much flack as it possibly can against restorative reproductive medicine for the very reason is that restorative reproductive medicine is directly over the target. I mean, it is an existential threat to the reproductive industry, and they are going to fight it tooth and nail. Absolutely.
mhm. And one of the most basic of fertility treatment is actually tracking your cycle, which we should have mentioned first, and obviously we did a whole episode on this, with Dr. Marguerite Duane and
Yep.
fertility awareness, but it's actually, in case someone hasn't listened to that episode, it's incredible. It's not just the quote unquote old calendar method. Right now you have devices such as Inito or Mira where using a urine sample, you can check LH, FSH, all these progesterone, estrogen levels, even though it's through your urine, it's not as it's more diluted than if you did a blood test.
Mhm.
But the fact that you can do this at home
Yep.
with a morning urine and it can tell you precisely when you're ovulating, if you're ovulating, and even confirm that ovulation has happened, that's your number one way to go. Just to even know what the cycle is. And this is obviously the couple working together to understand the woman's cycle. Obviously, actually, there's at home sperm tests that measure the quantity and quality of sperm of the sperm, or there's a DNA fragmentation test that you can also take and do at home in the privacy of your own home and send the results to the lab. So there even just as a diagnostic to just kind of understand where your fertility is. Are you ovulating? Are you not ovulating? Are you regular? Are the numbers where they ought to be? Is the LH surge happening? All those things are important as just to even know about your body. And I think what we need is a general education starting, I would say, middle school, right before girls get their periods to understand what's about to happen and for guys to also understand because I think that's part of it. People are put on the birth control pill for any and all reasons, whether it's
Yep.
acne or whatever it may
Yep.
be, and they don't understand how their cycle works. I think Dr. Marguerite Duane made a statement in that episode saying that a woman was saw her cervical fluid and thought that
Yep.
was an infection,
Right.
and she and her husband avoided during that time thinking that she had an infection, when in reality, cervical fluid is a sign of fertility, and that's when she's most fertile. So, we need the education, that fertility awareness education to even as a starting point before we go into all of these other treatments, potential treatments for infertility.
Absolutely. I mean, that's the starting point of all of it is actually understanding how your body works. It's funny, if you go back to Humanae Vitae, Pope Paul VI says, I forgot which section it is, about 8 or 9, something like that. It's a section on responsible parenthood. Like, what does it mean to be a responsible parenthood and a responsible parent? And the very first thing he says is having an understanding of the male and female reproductive systems and how they work. Just having that basic understanding is so crucial. And as you said, Irina, there's for many people, just having that basic understanding of when a woman can become pregnant, when she can't become pregnant, is it makes all the difference. And just one further thing, just another plug, because when you were speaking about, we need to be teaching this to young women and young men very, very young. We have I may have mentioned it earlier, we have a high school bioethics program. And we've put a course together that students can get college credit for. It's on our website. People can get information about it. But one of the things that we put in was exactly this. So I don't know if you've heard of Sarah Denny Lorio. She's a doctor down in the New Orleans area, and she's done a couple of videos. This is her thing. She goes around, she teaches this to young people, and she has a couple of videos in both the certification program and in a high school program. And this is the feedback that we're getting from high school students that, oh my goodness, we never knew this. We never knew nobody ever told us how our bodies worked. Nobody ever told us how our fertility is related to other health issues. And, if we're not fertile, and this is what fertility tracking can tell them, if we're not fertile, that can, that can point us to that there's other health issues that we need to address in our lives. And this was the first, you can tell this is the first time they've ever heard it. And they were thrilled to hear it. So absolutely, I agree with you 100%. This needs to be taught earlier, much earlier. And, the results are, I think the results would be very, very positive if we did.
Yes, and I know of some other curricula that we'll link to as well, and I would love to link to the one you mentioned as well, because these are coming out, right? These are being produced in order to help younger generations understand. Because what these in these past, I don't know how many decades since the birth control pill came out, as I mentioned, this was the end all be all of any condition you might have. Mm, and really it just flatlines fertility, right? It just completely obliterates fertility with a lot of effects, and we'll have a whole episode just on birth control coming soon. But I now let's go into some of the generally not acceptable treatments within the Catholic Church and why not. So, one of the things I had mentioned, and not just treatments, but also ways to treatment. So, what I mean by that is, even if you needed a sperm sample, for example, whether to check for DNA fragmentation or just to do a sperm sample, to get a sperm sample, obviously there are ethical ways and there are unethical ways. One of the unethical ways is masturbation, right?
Mhm. Yep.
Outside of the marital union. So, why is that wrong? And how does the church think about, if you need a sperm sample, what is a proper way to get one?
Yeah. I'm glad you came back to this because I know you mentioned this a little bit earlier, and I want to make sure that we, kind of talked about some of the ethical issues involved with this. Well, certainly, I mean, as you mentioned, masturbation is, it's seen as sinful in terms of Catholic teaching for a number of reasons. Probably the biggest one being, as you said, it's an act of self gratification, and it's done outside of the marital union. So it's an act that separates procreation and union from the proper sexual act. Now, unfortunately, as I understand it, most procedures or processes, I should say, to test sperm involve masturbation. You go to wherever the man masturbates, and the cup is given to whoever, and they do the teaching. We at the NCBC, we get this question every once in a while, in terms of, well, how do you procure a sperm sample for testing? And one of the things that, or one of the ways, or the way that we counsel people is that a couple could use, again, this is a married couple, you could use a perforated condom. And in fact, there are these out there, they're available to you. And so, when the husband ejaculates, the act is open to procreation, right? Because sperm is deposited in the vagina, but that condom is going to hold back, so to speak, some of the sperm, and then that sperm can be used for testing. Now, I've heard that there are labs that don't like that. They said that that's not it's not the best way to do it. But then I've heard other people say, actually, it really doesn't matter one way or the other. And so it's, is it permissible or is it possible to get a sperm sample from a marital act? And the answer is yes. We would
Yes.
claim at the NCBC, yes.
And there are labs that actually do that. And basically, they'll send you dry ice. They'll send you the whole kit. You then send back the sperm sample after the marital act, and then they send you the results.
Yeah.
So we'll link to some of those for people who are struggling with infertility and are looking for an ethical means of getting sperm samples. And one other comment on that condom. So usually condoms are spermicidal; they're trying to kill
Right.
the sperm.
Yes. Yes.
So this is a medical grade non-spermicidal condom, and whether if it comes perforated, then great. But you can also take a sterile needle and perforate it yourself if need be, and that'll achieve the same thing because it's open to life. There are sperm that end up in the vagina, but there are also sperm that are in the condom itself for the sperm sample. We already talked about IVF, but if you can sum up why IVF is not morally acceptable within Catholic teaching as a fertility quote unquote treatment.
Yeah, for philosophical reasons, it violates the church's teaching about the inseparable connection between procreation and union. Right. So every act of intercourse must be open to union. It's an act that brings a couple together, but that act must always be open to the possibility that life will be transmitted through it. And obviously, IVF breaks that. It's there. On the practical side, Tara Sander Lee did this much better than I could do, but there's all sorts of practical issues with IVF. There's the observation, the grading of the embryos. So you're objectifying them, you're selecting the best and getting rid of the rest. There's the freezing of embryos, and again, embryos are human life. These are human lives. And then, the questions of selective reduction. If you implant multiple embryos and multiple take, and you have a multiple pregnancy, doctors will reduce the pregnancy. Well, that's an abortion, right? So there's very profound philosophical and practical challenges with IVF.
And I'll add to that that there are higher risks for both the woman
Mhm.
and for the child, health
Yes.
problems. And so, again, we mentioned ovarian hyperstimulation syndrome, preeclampsia, etc. But for IVF babies, there's a higher chance of low birth weight, NICU stays, even a higher chance of abnormal genetic cases. And also, we haven't really studied the long-term effects of children conceived through IVF. And
Right.
I'd love to do an episode that goes more in depth into the research of that. But in addition to all the things you said, it actually has health implications, or can have health implications for both the mother and the child, or the
Yeah,
children in addition.
absolutely. Yep.
So, one of the ways that IVF is done, and we've discussed this before, is through ICSI, intracytoplasmic sperm injection. What is ICSI, and why is that also not obviously IVF in itself is not more morally permissible, and this is one of the ways that they fertilize the egg. Uh, why is ICSI and any other way to fertilize the egg outside of the marital union not the right course of action?
Yeah. So ICSI, as I understand it, it's you take egg from the woman, you take sperm from a man, again, probably through masturbation. And what they do is, instead of like with in vitro fertilization, the sperm and the egg are in a petri dish, and fertilization happens quote unquote naturally. Sperm finds the egg and fertilization happens. With ICSI, they actually inject the egg with a particular sperm. And so fertilization happens that way. Now, obviously, it's problematic because as we've said before, it's it's a substitution for the act of intercourse. And in fact, you have a child who's being conceived by a technological process. We haven't really talked about that too much. It's the child is coming into existence not as the fruit of a loving act between its mother and father, but coming into existence through the work of a technician, a third party, essentially, who's choosing a sperm, choosing an egg, and his or her actions are what precipitates procreation. And that raises a lot of concerns as well. And the church talks about this. Donum Vitae and in other places, they talk about this as being the domination of technology over nature. And so that's really what's happening here. So again, just really briefly, but there's a lot of issues, but that's kind of some of the main things with ICSI.
Right, and even with IVF or ICSI, you have grading to see, and
Mhm.
embryo grading to see which egg, which embryo,
Yep.
but also with the sperm, right? If in ICSI, they will pick whatever sperm they think
Right.
is the healthiest, quote unquote. But again, this is left up to the judgment of a lab technician, who then creates a whole new person by forcing a sperm into an egg, by his choice or her choice in deciding which ones are are chosen.
Yep.
What about, so as you mentioned, egg or sperm vendors, because as you mentioned, these are not donors; they're actually getting paid for giving their eggs or sperm, and also surrogates. Just basically introducing a third party apart from IVF process, introducing either a surrogate who will gestate the child, or an egg or sperm vendor who will basically donate genetic material, their egg or sperm, for procreation outside of that person.
Yeah. So with third party participation, certainly what you're doing is you're substituting for the act of intercourse. All right. So in terms of third-party participation, there's a couple things going on here. First of all, you're you're bringing in, as you said, a third party. So we're talking a heterologous procedure instead of a homologous. We're not talking about just the gametes of the husband and wife. We're bringing in a third person, and because of that, you're also going to be substituting for the act of intercourse. So that's obviously problematic, as we've talked all along. There's another side to all of this, and I think that the research is maybe starting to come out on this, is what is the impact on the children who are produced as a result of this? And so if, it's not uncommon for a woman to go to a sperm bank and get an anonymous quote unquote sperm donor or sperm vendor really, and have a child. Well, now you're bringing a child into the world who will never know its father. And we know from the social sciences and well, from the social sciences and other, the importance of a child having a relationship with both of its biological parents. We know this, and what you're doing with a sperm or an egg vendor is you're right off the bat you're denying a child a relationship with its mother. I'm thinking and surrogacy can do the same thing. When a child is in utero, it develops a very profound relationship with that person who is gestating it. Now, hopefully it's the biological mother, but even with the surrogate. And then when the child is born, that is taken away, right? And we're starting to learn some of the effects, some of the physical effects, but there's also psychological effects. And I thought I won't mention the name, but there was a very well-known entertainer, a male, who is quote unquote married to a same-sex partner, and they wanted children, and they had quote unquote their children, but they, I guess, sperm of one of them, and then they got an egg donor or an egg vendor and a surrogate. And someone asked that person, what are you going to do, or how are you going to respond to that child? And these two people were very outspoken in terms of, this is such a wonderful thing. We're a same-sex couple. We're going to have this baby. And someone asked this person the question, well, what are you going to do? How are you going to answer your child when someday they ask, where's my mommy? All these other children have mommies. Where's my mommy? And this person was silent and did not have an answer to that. And so I think what we really need to look at, particularly when we're talking third-party participation, in addition to everything we've talked about so far, is what's the effect on the child, both physically and psychologically, in terms of that. And I think I think people are starting to ask those questions now.
Yeah, and in addition to that, I recently heard a story about a couple meeting and getting ready to get married, only to realize that they were biologically related. This happens especially when there's a quote unquote popular sperm vendor. Everyone wants, the certain characteristics of the
Yep.
sperm donor vendor, and so if that if his sperm are used from the sperm bank, and he apparently has hundreds of biological children all within a certain radius of the fertility clinic, well, there's a chance that those children will meet each other and date each other,
Yep.
etc. So, I mean, there's so many, or the fact that they don't even know that they have half siblings somewhere out there,
Yep.
hundreds of them potentially, you
Yeah.
know, so
Absolutely.
many issues.
Yeah, just in terms of surrogacy too, there's grave questions about the surrogates themselves, how they're being, how are surrogates treated? I think Jennifer Lal, who I think you had Jennifer on a podcast earlier, and some of her work talks about, if you look at surrogacy contracts, I mean, essentially, she talked to them as forms of modern day slavery in terms of what, the surrogate has to do this, and this, all these, various things in terms of their lifestyle. If the couple or the person who's contracting for this child, there's some genetic anomaly, you have to abort, all of these things. And then there's, a lot of this, the surrogacy that's happening in the developing world. India's a big thing. Poor women are being, they become surrogates to make money. They make a little bit of money. It's the organizations that, the fertility organizations are the ones who make most of the money. But there's that exploitation there. And then there's also people who will hire surrogates. Like there are wealthy people from China who will come over to the United States, hire a surrogate so their child is born in the United States as a pathway to citizenship. Right. So there's all sorts of, in addition to the philosophical and ethical issues that we bring up, there's very practical concerns involving surrogacy and, third-party vendors of sperm and egg as well.
Yes, and even military wives, especially, are there's a higher percentage or a higher rate of surrogates being military
Really?
wives.
I didn't know
Yes,
that.
but also, as you mentioned, whether it's a surrogate, right? The baby, there's a bonding that happens when a woman carries a baby. We know that there are cells from the baby, from each pregnancy that a woman has, that migrate to, was it to her brain? Is it to other parts of her body? So there are parts of the baby, of each baby a woman carries, whether that baby ends up being miscarried, aborted, carried to term, or given away, as in the case of with a surrogate. She has some of that baby's cells with her forever, and she will carry them forever.
Okay.
Right? It's so there's this bond that happens that the fertility industry just ignores, right?
Right. Yeah.
But I wanted to talk some more specifically about IVF, because obviously IVF is the number one method that is used and most popularly used, right? And you already talked about this, about the embryos, right? That there's embryos that are created, frozen, discarded, and selected. Why is embryo destruction such a central ethical issue? In addition to all those other things you had mentioned, obviously, with IVF, you're separating the marital union, you're creating children outside of
Right.
that, all of those issues you mentioned. But talk about the embryo destruction, please, and what this means for human dignity.
Yeah. Well, it's such a central ethical issue because an embryo is a human person. That's what we're talking about. We're talking about a human being who has the same moral value arena as you and me and every other person on the planet, right? And so when we're talking about IVF, what we're really talking about is, well, certainly the manipulation of the beginning of human life, which is problematic, but also in many cases, the destruction of human life through the IVF process. I read somewhere that I think it's something like for every, and I believe this is a conservative estimate, that for every child who's born, at least in the United States, anyway, for every child who's born in the United States through IVF, there's it's either 7 or 8 or 9 embryos are destroyed. And again, I personally, I think that's a little bit conservative, but let's go with it. But think about that. For every child who is born from IVF, 8 children, their brothers and sisters, are destroyed. And that could be through just, they didn't pass the screening process. They may be in frozen storage and they died there, selective reduction, as we talked about. So what we're really talking about is, how do we understand the value of human life? And what I will say is that I think a lot of this goes back to, the abortion industry has done a really, I mean, give them their due. They've done a masterful job of convincing people that nascent human life is not human life. All right. If we can just abort children, well, what you're saying implicitly or explicitly is that this is not a human life. And I think that mentality reaches forward in terms of IVF. I think most people who do IVF don't consider the situation, don't consider the reality that, we're manufacturing real human lives here, and we are responsible for it. Back when we lived in Cincinnati, there was a couple who we knew. They weren't Catholic, certainly. I don't think they were religious at all, but they did IVF. And they would tell us about the experience, and it was so cavalier. The husband even said one time, he said, yeah, we do this, that, and we implanted X number of embryos, and if multiple pregnancy comes, we just do the selective reduction. We get, and I'm just like, do you have any you know any clue really as to what you're talking about? These are human beings. An embryo is it's a living organism of the species Homo sapien. I mean, that's a biological scientific fact, and that's what we're dealing with here. So I think it is such a central issue because we're talking about human lives, and just listeners will remember, I think it was back in 2024, the Alabama Supreme Court made a ruling. It was in an IVF center. There were frozen embryos, and something happened. I don't know exactly what happened, but the electricity was cut. Maybe a cryogenic container was unplugged or something. I don't remember exactly what happened. But the embryos that were frozen, they thought, and obviously they all died. And the parents sued the center for wrongful death. And the lower court said, it's, IVF embryos are property. In fact, legally, IVF embryos are considered property, which raises a whole nother set of questions. But the Alabama Supreme Court came back and said, well, no, actually, these are human beings. And so the couple could seek damages for wrongful death. But when that came out, it was just like, the abortion industry went crazy. The assisted reproductive technology industry went crazy. And then there were all of these efforts to protect legally IVF, including in Alabama. And so, this is, it's the central issue here is what are we dealing with? And we're dealing with human lives. And there's a large percent of our population that doesn't see that, but it's, in fact, it is true. I mean, this is, we're dealing with human beings in their most nascent state.
Mm-hmm. Yeah, and I think that one major issue, especially among faithful Catholics or faithful Christians who are trying to straddle both ways, will say, well, there's a pro-life way to do IVF. They'll say, you can just fertilize one embryo, only implant one embryo. Why is that problematic? Even if it were true that, let's say in theory, you just fertilize one embryo and you implant that embryo, and that embryo implants and successfully.
Yeah. I mean, I think it may be less morally problematic in the sense that, you don't have multiple embryos. And I believe there's countries in Europe, I believe Germany is one, that you can only manufacture as many embryos as you will implant. But all of the other issues that we talked about come in. I mean, you're substituting for the marital act. You may be bringing in a third party. Well, you are bringing in a third party in terms of the technician. And the child is being manufactured. And I use that term purposefully. In IVF, a child is not being conceived. A child is being manufactured. You're using a technological process to bring about human life. And so, yeah, arguably, maybe it's better that, okay, we're not manufacturing all of these embryos, but all of the other ethical issues that we brought up, do apply as well.
Right. And so it's still morally problematic in the Catholic Church, whether or not it's one embryo, or even if you say, we will fertilize a bunch of embryos and implant them all. Same difference. It still bypasses the marital union, as you said, and all the other issues related to IVF. So I know that we already talked about this with Dr. Tara Sandra Lee. So what are the ethical concerns that arise with egg freezing or embryo freezing?
Yeah, so a couple things, and I just want to make a distinction in terms of egg freezing. So we'll sometimes get questions from people about, let's say someone has cancer, they've been diagnosed with cancer, and the doctors will say, you can freeze your eggs. We would counsel against that because as we speak right now, the only thing that you can do with those eggs would be IVF. So that would be problematic. However, there are procedures that I've heard of where parts of the ovary will be frozen, and then after the treatment for cancer, whatever it is, then it could be reintroduced, and so a woman could have children naturally. So just want to make that distinction there. If the egg freezing is being done for some, like many young women who are not married, they'll freeze their eggs for future IVF purposes, as we've talked about, as you guys have talked about on previous episodes. That's problematic because you're going to be using IVF. But again, the ovarian tissue freezing, it could be permissible, as long as that, as long as it's going to be used in the future, hopefully, for pregnancy to occur naturally. Embryo freezing, problematic on a number of different levels. Certainly philosophically, you're freezing human life, right? You're suspending the growth of a human being. And I think, I don't know, and Irene, tell me if I'm wrong on this, and I believe and it's maybe a good thing, but the longest time an embryo has been frozen and then brought, thawed and implanted and a child being born, I think it's 23 years.
I think
So
there was one, I'll have to check, but I think I heard there was one of 30 years,
really,
but I will have to check.
but think of the dynamics that creates within a family. as well. So like your sibling could be 30 years younger than you, and all of these things. But, but the real question is, in terms of, in terms of, is this in keeping with the human dignity of a person to keep them in frozen suspension? And then going back to Jennifer Lal at the Center for Bioethics and Culture Network, again, we link to a document that they have in our certification program. And there are some studies. And again, this is new as far as I know. But there's emerging evidence of health issues that arise with frozen embryos, and particularly around childhood cancers like leukemia and neuroblastoma. That they're seeing these realities, these physical realities manifesting themselves in embryos that were previously frozen and then thawed and implanted. So again, philosophical concerns, theological concerns, but also very practical medical concerns as well.
So, and we also increasingly hear about embryo grading, genetic selection, and designer babies. And of course, we did the episode, Dr. Tara Sander Lee, on
Yep.
this, if you want to
Great
delve into
episode.
this.
Great episode.
But at what point does reproductive technology risk turning children into products rather than gifts, as we discussed? And are we moving toward a consumer mentality regarding children?
I think, to be honest with you, I would say that the entire reproductive technology industry is turning children into products. I mean, I think that's what's happening. You can't, you're unable to have a child on your own. Give us enough money. So give us enough money and we'll, hopefully give you a child. Children become commodities, right? They are products. I think that's really what's happening there. If it's a question of, and I know we're kind of going into Tara Sander Lee's podcast here a little bit, and I don't really want to do that because she's a lot smarter on this than I am. But I think in terms of, like genetic testing and genetic screening, I think, those can be permitted. Now we're talking, this is outside of the whole IVF thing. I think they're permissible, certainly if they're used for therapeutic purposes. If there's an indication that there's something, there's a genetic or other abnormality here, and this testing can help us to prepare for when this child is born, and to be able to give this child the care that he or she needs. That there's no moral problem with that. Where it becomes problematic is when you start getting into enhancement, or when you start getting into eugenics. When you're trying to, select heritable characteristics to quote unquote improve future generations, that type of thing. So I think, just in terms of the testing, I think there's good uses for it. There's also not good uses for it. But at the same time, I really think I think that the technologies, particularly those that we've talked about, like IVF and whatnot, they really do make children become products instead of, as we said before, the fruit of a loving act between a husband and a wife.
Mm-hmm. And even with them, not only is there embryo grading, but embryos can be chosen and discarded, whether or
Sure.
not they're male or female, just
Oh yeah.
depending on what the couple wants. Oh, we want more girls, or we want boys, or whatever they want. And of course, all of that is such a consumer mentality towards human life. And these are their children, so it's yes. This I'm glad we touched upon that.
Yeah.
I want to talk about some morally unresolved technologies and why they're morally unresolved, according to Catholic ethicists, the Catholic Church. So one of them is intrauterine insemination, also called IUI. And why is this considered morally unresolved by Catholic ethicists?
Well, I guess in my mind, I think it is resolved, to be honest with you. And I would go back to Dunham Vitae, the document that I referenced earlier in the podcast. And in part 2, section B, section 6, subsection 6, Dunham Vitae has it's talking about artificial insemination. And I'll just read the last line of it. It says, artificial insemination as a substitute for the conjugal act is prohibited by reason of the voluntarily achieved disassociation of the two meanings of the conjugal act, the procreative and the unitive. So if IUI is, and this is how I understand it, and correct me if I'm wrong, you're taking sperm from the man, from the husband, and I believe the process is they take it and they quote unquote wash it and then inject it into the wife's reproductive tract. Well, to me, that would be substituting for the act of intercourse. If IUI, or if insemination were a situation where there was an active intercourse, sperm was deposited in the vagina, and then a procedure to help the sperm get to where it needs to go in the fallopian tube, that would be assisting. That would not be problematic. But as I understand IUI, the sperm is taken out, it's washed, and then it's reintroduced to the wife's body, and I would see that as being substituting for.
Okay. And what about gamete intrafallopian transfer, which is also called GIFT?
Gift.
Why is there a debate about its moral status?
Well, again, same thing. I mean, I think there's a debate because I think, as with IUI, some people will say that the church is not definitively taught about it. Gift is a procedure, as I understand it, where sperm and egg are retrieved from the parents. You can see this is probably a substitution procedure here. The sperm and egg are placed in a catheter, it's separated by an air bubble, and then introduced into the woman's body so that fertilization happens in the body. So fertilization doesn't happen in the tube. I would see that as being substituting for the active intercourse. That'd be my take on it. And the other thing about gift is that we've had some questions about this recently, and from what we can infer, gift really isn't done. It's very difficult to find some place that would even do it. I'm assuming it's because it's probably not that, it hasn't been that successful, but it's rarely, if ever, done today. But I would say that it substitutes for the active intercourse, at least as I understand how it's done. And so I would say that it wouldn't be morally permissible to do.
And how are these two procedures different from low tubal ovum transfer?
So low tubal ovum transfer, what you're doing is you're taking the egg, you're bypassing whether it's a blockage or whatever the case is, and moving the egg to a place where it can be naturally conceived. It could be naturally fertilized by a sperm. In these cases, what you're doing is you're actually removing, in IUI and with GIFT, you're actually removing both egg and sperm from the bodies of the mother and father, and then, or at least egg and sperm in GIFT, sperm in IUI. You're actually removing it from the bodies of the two individuals, and then reintroducing it through a technological act. So I would see that, in that way, the procedures are very different.
So, I mean, it sounds like these two that were in the category of morally unresolved are probably morally problematic. Are there any Catholic ethicists that you know who would argue that these are still morally unresolved?
There probably are. To be honest with you, I don't hear discussions about these really happening anymore, and I just maybe not paying attention to it. But I don't really hear, these happening. I think really more the discussion, at least from our perspective anyway, the discussions are really more about, let's focus on restorative reproductive medicine, naprotechnologies. Let's see if we can figure out, what's the root cause or causes of the infertility, and let's address that and move forward there.
Hmm. Let's talk about hard cases and more of the pastoral questions that couples may be facing. So, what should Catholics do if they conceive children through IVF? As you said, some people may have done that and then had a conversion or reversion and realized, whoa, maybe we shouldn't have done that. But now they have frozen embryos. And what should they do if they do have frozen embryos before understanding the church's teaching?
Yeah. I think the first thing, and actually I've had conversations with people who have been in this particular situation. I think the first thing to do, and many people do this, is repent and say, go to confession and say, I didn't know, or, whatever the case may be, and get that sacramental absolution for it, which actually really, it goes a long way in terms of, alleviating crises of conscience and everything else. So that would be the first thing I would do. The second thing I would then do is seek really good guidance about, if you have these so-called leftover embryos, those that are in cryopreserve, seek some good, faithful guidance about what to do. And this is the hornet's nest, as you know. The embryo adoption question. There are a lot of different perspectives. The church has not definitively pronounced on the ethics or the morality of embryo adoption, other than to say that it should not be used as a means for overcoming infertility. And then we could get into a big discussion about what all that means. But, get some good advice from, whether it be a faithful priest, spiritual director, or us at the NCBC. And because I think what really has to happen is that people have to make good, informed judgments of conscience in terms of what to do with their so-called leftover IVF embryos. And there's not a one-size-fits-all answer to it right now. So it's going to take a lot of discernment and a lot of prayer. But I would always encourage people to not sort of act in it with a knee-jerk reaction, but get some good guidance in terms of what's the best way forward to deal with this issue.
Yes, and you hit the nail on the head that embryo adoption is a hornet's nest. And on this show, we will have, I promise, I plan on doing a couple episodes at least, one for, one against, because obviously there's a lot of debate even within the Catholic bioethics world about what to do
Absolutely.
about the frozen embryos. So I would like to present all sides of the issue, potentially even do a debate. I'm not sure quite yet what this format will look like, but just in terms of just if you can capture the bigger questions about embryo adoption and from all sides. Why is this one of the most difficult questions, and why is this debate so complicated, even among Catholic ethicists?
Yeah. How much time do we have now? No, you're right. I mean, it is a huge issue. I know the Catholic Medical Association has had debate about this, at their annual meeting. It's just kind of going back. It's a very, very difficult question. And in fact, we have 6 full-time ethicists here at the NCBC, and we have, let's just say, 6 different nuanced responses to the question of embryo adoption. So it's really, really, it's really a very controversial question. I think if I could, for me, I think that I'll give what I think are and we'll give the strongest arguments both for it and against it. So I think the strongest are, we'll sort of steelman it a little bit. I think, embryo adoption, it's so difficult because there's competing values at play. And for example, one of the main arguments that's used by people who oppose embryo adoption in every case is the church's teaching that a husband and wife can only become parents through each other, right? They have a reciprocal right and duty, really, to become parents only through each other. And embryo adoption, that certainly can violate that teaching, right? That's a very powerful teaching, right? And a very powerful argument. And I acknowledge that argument. On the other hand, as we've kind of talked a little bit about here, particularly if you've got children who are in frozen storage, these are human beings, right? And we all agree on that. They're human beings for whom an incredible injustice has been perpetrated. I mean, it is completely unjust to freeze someone, to suspend their growth, in a cold, literally freezing container. And so the question becomes, well, injustice, what do we owe to them? Right. And I get this one. I'm going to give Father Ryan McCarthy from the Archdiocese of Indianapolis. This is where I got this from him. It would seem that as a matter of justice, I mean, justice being the virtue by which we give to the other what is owed to them. It would seem to me that in justice, we should, if there's an opportunity to do this, to give a child the ability to live its life. We have an existing human being, and give that child the ability to do it, to live their life as a matter of justice. So here you see we have 2 very important competing values. And these are just 2 of them. I mean, you could, as you said, you could have debates and you could go on for hours and hours. And I'm not going to go on for hours and hours. And don't have me on for that debate because but it's such a complicated issue, and people have, again, there's a whole range of people, a whole spectrum of people who are going to hold positions that are completely against it. People are going to hold positions that are in favor of it, and then there are going to be people who are going to hold, it may be permissible under certain conditions. And so it's a wonderful academic exercise to talk about. And in fact, just another selfless plug for the NCBC. Just a few months ago, we put out our embryo adoption book, volume 2. So there's a volume 1, there's a volume 2. If people want to see or want to read the debates on these issues, those 2 books are available on our website, and believe me, you'll get an earful in terms of the arguments either way.
and we'll link to those books as well. What guidance would you give to couples who have spent years pursuing fertility treatments and feel spiritually and physically exhausted?
I got to be honest with you, Irene. I saw that question, and I'm not sure I have a really good answer to it. And I say that because I haven't experienced it. You know, I would I always think that, the best people to answer questions like that are those who have experienced it. And so I guess what I would do is the guidance I would give them is to say, okay, to look up organizations, preferably faithful Catholic organizations or individuals who have dealt with this. I mentioned earlier Marie Meany's book. I would encourage people to read that, to ponder that, to discern that, discuss that with spiritual director, and and look towards finding faithful people who are in the same situation. And you may know more about this than I do, but find people who are in these similar types of situation for to give the support that that can be given from someone who has actually experienced this. In addition to that, I always encourage people, and we mentioned this before, to educate yourselves. And I would also, as I always do, is encourage people to to become educated on what the church teaches and why it teaches it. Because as we mentioned a little bit earlier, I think maybe some of the anger, some of the frustration may come about because of just not knowing and not realizing that the church is teaching in this area, and really in morality in general, it's there for our good. Oftentimes we think of morality as, and church's teaching on morality as, you can't do this, you can't do that. Yeah, and there are situations like that, but we have to understand the reasons why. As John Paul II said, that behind every no, there's a greater yes. And what are we opening ourselves to? When we act in accord with church teaching, which we believe this is what's revealed by God for our flourishing. What is truly for our flourishing, and that's really what the church's teachings is, what the moral law is meant to be. So
Absolutely. And also for our listeners, if you're looking for more resources, especially on infertility and also on fertility treatments, as we discussed, that are morally acceptable, on the bioethicsbabe.com site, we have a resource page, and there's a infertility thumbnail. There's one on restorative reproductive medicine, and click on those. I know that for the infertility section, there are organizations like Springs in the Desert. I
yep.
mentioned Lee Snead's book as well. So those are just some of the resources. How can pastors and churches better support couples suffering from infertility without reducing the response to just pray harder?
Yeah, I think I, again, I think it can be very difficult for pastors because this is not a reality that they experience. And so it can be very, very difficult for them to do. I think one of the things that pastors can do is listen and, to just hear the experiences of people. I think, kind of as you mentioned before, become aware of resources that may be available. Either maybe there's something in the parish or something in the diocese, or, the resources that you just mentioned as well. And also to always remember, and again, you mentioned this earlier too, that always remember that, when they're giving their homilies, there's someone, you know, odds are there's someone in the pew who is experiencing infertility, and to be aware of that, to understand that, in what they're speaking of. A priest friend of mine once said, he was told that, a different topic, but in talking about abortion, that, if you're talking about this in a homily, you got to think that maybe a third of the women who are sitting in that church have experienced abortion. And so you got to be careful with that. And I would say kind of the same thing here is to, to really recognize and try to, as best they can, approach this from, as pastorally sensitive position as possible.
I think one of the things that seminary should do is just do more training for the seminarians, for our future priests, on all of these issues, whether it's on abortion or infertility, miscarriage, etc. Or if you're an active parishioner, which I hope many of our listeners are, and you have a gift, or you can bring such a ministry to your parish, even just a meeting group, right, to meet up to talk about these things. I think that would be super helpful in just embracing the people in your community who might be facing the same thing that they face, right? You faced. So in terms of if someone's been in that situation, whether it's miscarriage, whether it's infertility, whatever it might be, that could be a service that you can give to your local parish just by bringing people together to just talk about it. What practical advice would you give to Catholic couples beginning the infertility journey right now?
So, yeah, that's I guess it kind of depends where they are. Is there a diagnosis of infertility? Or are they simply, are they having difficulty becoming pregnant? So I think the advice would be maybe a little bit different depending on where they are. I think if a couple things, and going back to some things that we talked about earlier, I think the first advice, practical advice I would give for them is to try to figure out, okay, what's the cause of this? All right. Are the physicians that you're seeing or the doctors that you're seeing, are they seeking to try to determine what's the cause of infertility? Or are you being kind of pushed right into, to assisted reproductive technologies, particularly IVF? And I say that because there's someone, she will remain nameless. She's a very good friend who was in this exact situation, faithful Catholic, experiencing infertility, went to her doctor, and immediately they said, well, we don't really know, but here, let's go see we'll refer you to a reproductive endocrinologist and you can start the IVF process. And she's like, no, I'm not doing that. So I think it's, look for a physician, an APRO trained physician. And I'm sure, Irina, you have a database for that. We do as well. You can contact either one of us. Or even Facts About Fertility. Marguerite Duane would be who you had on the podcast. Great organization for finding a physician who is going to really sit down with you and try to figure out, okay, what's causing the infertility. So that would be the first practical thing. The second thing, kind of going back to what we've been saying all along, is educate yourself in terms of, particularly from a theological perspective. What does the church teach? What does it not teach about assisted reproductive technologies? Which ones are ethical? Which ones are not ethical? And so that if you get to that point, you have that knowledge there, and it's you're not if you're not blindsided, so to speak, to try to be pushed into one intervention rather than another. So I would say those two things as practical first advice.
Yeah, and I think there's so many amazing NAPRO doctors and
Yes.
doctors who are really trained in this. And so finding the right doctor, one who you're not going to fight, right? You want someone who's on your side, stands by these values, so that you can work out a treatment solution together that is morally acceptable. And like I said, there are. And so we will provide the directory and the list for those things
Yeah.
for
And
our
in fact,
listeners.
and as you mentioned before, restorative reproductive medicine, the data that we have right now, it's twice as effective in terms of achieving pregnancy at a quarter of the cost. So just,
Yes.
again, very practical reasons for pursuing that.
Hmm. Do you think that modern fertility medicine reflects a broader cultural discomfort with limits, suffering, and dependence on God?
Sure. Yes. And I think this really kind of gets us into the next question as well, too. But I think there's cultural discomfort with anything that is deemed as challenging. Our society gives us ready-made answers to a lot of things. And I think the ART industry is, it's a product of that. Here's a limitation you have. We have a ready-made answer. And, why would you not want to pursue that? So I think, yeah. And yeah.
Hmm. And in your view, what does infertility reveal about modern ideas of autonomy, control, and technology?
Well, autonomy, as you well know, it's the prevailing value, so to speak, in modern society, and certainly in modern medicine. And the IVF industry and everything that it promotes is a clear example of this. And it's the ART industry, as I mentioned before, it's predicated on you, the adult. It's all about you. You have a right to have a child if you want a child. We're going to make it happen. Nobody can tell you what to do or not to do. So it's all about you. The IVF industry, I think, very much it personifies that understanding of autonomy. Control, same thing. We have a societal belief that we can control everything in our life. I mean, we can control our sex. We have so-called gender affirming care. We can control our death with the continued growth or expansion, I should say, of assisted suicide in the United States. And so that control simply extends to human life. You saw with one of your previous episodes the organizations Orchid and Nucleus Genomics. These are organizations that you do, couples do IVF, and then we do polygenic testing on these embryos, and we give you we can give you your best baby. I think that's actually one of the slogans of one of those organizations. We're seeking to control everything. So again, certainly the ART industry plays into this. And lastly, I know I've mentioned this before, but technology in our world today, it offers us the means to do a lot of very good things, but this doesn't imply that all technology is good or that technology is always used for good purposes. I mean, certainly AI is a great example of that today. But the similar technologies within medicine, they can be used for good, they can be used for evil, and we need to discern the correct way to use them.
Yes, absolutely. And speaking of control, it's when kids are seen as products, you say, "I want one, so I'm going to
Mhm.
go and get a child by whatever means." But then on the opposite side is, "I don't want a child, so I will just abort the child." So it's when it's based on autonomy and it's not based on seeing children as gifts, then life is easily discarded that way.
Absolutely.
Lastly, if listeners remember only one thing from this conversation, what do you most want them to understand about infertility, reproductive technologies, human dignity, and Catholic teaching on it?
How about three things, real quick,
Sure.
instead of one thing? First, in a very practical sense, the Catholic Church is not against assisted reproductive technologies as a whole. I think that's a myth that those in the ART industry would like to put forth. As we mentioned before, interventions that are homologous, involve only the husband and wife, and assist rather than substitute for the marital act, are perfectly permissible. And they can be pursued. Secondly, I would say that if you're experiencing infertility, and again, we've talked about this, but if you're experiencing infertility, get good information about the options available from restorative reproductive medicine. And there's organizations, Facts About Fertility. Arena, you mentioned you have resources. We at the NCBC have resources as well. Get good information about medical options, ethical medical options that are available to you. And lastly, if people are facing infertility and they have specific questions about their particular situation or about particular interventions that have been presented to them, please reach out to the NCBC. We have our consultation service. You can access it through our website, ncbcenter.org, and then click on the button that says free ethics consultation. And you can either write in or you can call in and you can talk to one of our ethicists, and we'll hopefully help you to walk through the situation and address the situation from a faithful Catholic perspective.
Well, thank you so much, Joe, for your time, your knowledge, your insight, and expertise on this. Well, thanks again for being on, and we'll surely have you back.
Awesome. Thanks, Serena, and God bless.
For my conversation with Joe Zalot, Director of Education at the National Catholic Bioethics Center, here are 5 key takeaways regarding infertility and assisted reproductive technologies. 1. Infertility is a real cross, and the Catholic Church takes that suffering seriously. The Church does not dismiss the pain of infertility or simply tell couples to pray harder. Infertility can be a profound emotional, spiritual, and relational burden. The Church recognizes that suffering while also offering ethical pathways for couples who desire children and want to remain faithful to Catholic teaching. 2. The Church is for ethical fertility treatments that do not replace the marital act. The Church supports treatments that help restore or assist normal fertility, while opposing technologies that replace the marital act or introduce third parties into procreation. The key distinction is whether a treatment assists conception or substitutes for it. 3. Restorative reproductive medicine treats the cause. IVF bypasses it. Approaches such as fertility awareness, naprotechnology, restorative reproductive medicine, surgery for endometriosis, hormonal treatments, and other interventions seek to identify and correct the underlying causes of infertility. IVF, by contrast, typically bypasses those underlying health issues rather than resolving them. 4. Children are gifts, not products or entitlements. One of the central themes of Catholic bioethics is that no one has a right to a child. Every child possesses inherent dignity and should be received as a gift rather than produced through a process of selection, manufacture, or acquisition. This perspective shifts the focus from adult desires to the dignity and the rights of the child. 5. The IVF debate is ultimately about human dignity. The Church's concerns about IVF extend beyond embryo destruction. They include the separation of procreation from the marital act, the creation and freezing of embryos, eugenic embryo grading and selection, third-party reproduction, surrogacy, and the growing tendency to treat human life as something that can be manufactured, controlled, or discarded. At its core, the debate is about what it means to respect human dignity from the very beginning of life. Because truth matters and human dignity isn't optional. This is Bioethics Babe. Thanks so much for listening to this episode of the Bioethics Babe podcast. If you've enjoyed this content, please subscribe to my YouTube channel and your favorite podcast platform, and share with your friends and family. Also check out bioethicsbabe.com for the latest episodes and resources.